I want to talk to you now about the vaccine, because Donald Trump has said recently over in America, Robert Kennedy Jr., who's been campaigning a lot against the vaccine harms and so on and so forth, that, you know, he also thinks that there are big questions that need to be answered. I don't think we've got to that stage yet in the UK. There are pockets of people talking about vaccine injuries, pockets of people talking about whether or not there was a cover-up when it came to not just encouraging everyone to get the vaccine, but in some countries there were vaccine mandates, and if you wanted to go get a cup of coffee, if you wanted to go to your workplace, you had to have this shot in your arm. And now people are saying, well, look, was it tested? Has it caused side effects? I know that you're someone who thinks this is so important to talk about. I mean, you're a cardiologist. What have you seen? What evidence do you have that the vaccine actually might have had some pretty devastating impact?
Well, I think the best evidence so far actually was a reanalysis of the original trials done by Pfizer and Moderna that led to approval, coercion, and even mandates of this vaccine, if you call it a vaccine, although it's nothing like traditional vaccines anyway. I think it's better described as a form of genetic technology. That analysis was published in peer-reviewed journal Vaccine, done by very eminent scientists, the associate editor of the BMJ, Peter Doshi, Joseph Freeman, who I know is a lead author. And what they found, Alex, from the beginning, and this is what we call the highest quality level of evidence, is that you are more likely to suffer serious harm from the vaccine at a rate of about 1 in 800 than you were to be hospitalized with COVID from the very beginning, which for me is an automatically suggests that it probably, and this is across all age groups, so we don't have the data to, you know, separate age groups, but 1 in 800 is a very high figure. It probably should never have been approved for authorization for a single human in the first place. So the question then one would ask was, well, how did this happen? Well, of course, you've got the medical regulator, the MHRA, who approved it, but everything happened very quickly. There's a big problem, which, again, most people don't know, most doctors aren't even aware of. The chairman of the BMA was gobsmacked when I gave a presentation at the BMA annual conference in the summer of 2022, when I presented him information from the British Medical Journal investigation that revealed the MHRA in this country, our regulator, gets 86% of its funding from the pharmaceutical industry. So for me, this is a form, if you like, of institutional corruption, which is at the root of the problem.
I mean, what have you seen, what have we got so far that is evidencing the fact that vaccines could have harmed some people? We're not saying that it's harmed everybody.
No.
But what have you seen, and where's the evidence?
So there are many different levels of evidence. So you've got what I already mentioned, the randomized controlled trial data. You've got something called high-quality observational data from Israel, published in one of the Nature journals, that showed, certainly when it comes to heart disease, a 25% increase in heart attacks or cardiac arrest in people aged between 16 and 39, associated with the vaccine, not associated with the COVID. You've got autopsy data that's confirmed that maybe more than 70% of the people who suffered sudden death within a few weeks of the vaccine, it was definitively determined that the vaccine was a likely cause. You've got clinical data. I've got my own patients where I've made diagnosis of vaccine injury. It is pretty horrific, Alex, honestly. I don't think, and I try not to be inflammatory here, but for me, reflecting on everything that's happened in the last few years, my clinical experience as a cardiologist, as a doctor over more than 20 years, I think this is probably going to turn out to be the most horrific medical product that we've inflicted on the British population, and probably the greatest corporate crime that has been committed by the drug industry. Now, I don't say that lightly. I was a witness in court in Finland where a business entrepreneur had not taken the vaccine, and he was refused entry into a cafeteria because he didn't have a vaccine pass. So he was suing the Finnish government and this particular, this company for human rights violations. Now, what was really interesting in that case, and I submitted evidence over 2 hours and explained my journey in this, because I also had the vaccine. I went on Good Morning Britain to reassure people it was likely to be safe. So I'm not somebody coming from the traditional, vaccine skeptic lobby, if you like. Yeah. And what emerged in that case, which was really interesting, is one of the chief scientists of the World Health Organization on vaccines, Hanna Nohynek, under oath said by December 2021, so this is when the whole mandates were being pushed out, the protection from COVID, from the COVID vaccines, was zero. Zero. Right? And the advice was given apparently to governments, but they didn't listen. And now we know from investigative journalist Lee Fang in America that actually Pfizer themselves had given thousands and thousands of dollars to various grassroots organizations in America to push the narrative for mandates. So they were behind it. I texted Sajid Javid. I was given his number. As you know, I speak to many politicians across party. And I messaged him and said, Sajid, somebody's misled you here, because he came out in Parliament and said this mandate should be imposed on healthcare workers. And he didn't really have an answer. I'm going to answer this in the COVID inquiry. Fine, I get that. But Alex, what's really important on this as well, very specifically to mention before we go on to the next point, is that I recently became privy to a GMC letter, General Medical Council letter, to retired police constable Mark Sexton. He's happy for me to share this with you. And what was interesting, he had made a complaint about certain doctors getting paid to promote the vaccine, right? They had come back and said they're not going to investigate that. But what was very interesting in the wording, Alex, is the GMC, in their letter, have devolved responsibility for the vaccine rollout to the Department of Health and the government. He said they should contact the Department of Health, not doctors. Doctors were misled, and that's really interesting.
There's a whole lot to unpack here. We don't have much time, I'm afraid, Aseem, because I actually do have to go to a break now. Philip, very quick response from you, because there's so much there. I mean, and some of the points Aseem is making are huge. Obviously, we'd have to give right of reply to everybody who has been labelled during this discussion.
Huge points there. Generically, your vaccines have saved so many lives for so many different diseases over so many years. So this is COVID specific. And with the COVID specific, there were some new technologies brought out in the vaccines that came out there that it would have been much better if our COVID inquiry, instead of examining Boris's WhatsApp, went in to examine the science behind these new vaccines, because that technology has been used into other potential vaccines elsewhere, and we need to understand the implications of that and put
These
that
are the
context.
big things that need to be looked into very quickly.
One final point. There needs to be a mea culpa. Donald Trump needs to come out. Why did he support Operation Warp Speed? He needs to say there is a problem with Big Pharma, there's a problem with corporate capitalism in the way that its excesses are causing great harm. Their business model is fraud. Doctors now should not be afraid to speak out. I have doctors approach me all the time saying, Aseem, you're right about the vaccine, I'm frightened to speak out. There is a petition called the Hope Accord, which has been signed by more than 1,000 doctors, 40,000 people, thousands of healthcare professionals. People can go online and sign that, and we need to keep pushing this forward.
OK, well, Aseem, thank you so much for